The roles of healthcare providers are absolutely essential to ensuring that patients receive safe, effective, and compassionate care, especially in complex settings like the emergency room and during hospitalization. Each healthcare provider, whether directly involved in clinical care or providing supportive services, plays a vital part in the patient's experience, their treatment, and recovery. So what we're going to do is we're going to follow a patient named Sarah as she arrives to the emergency room complaining of abdominal pain. So Sarah arrives at the ER, and the patient care specialist records her information and signs the patient into the ER. A triage nurse then evaluates Sarah's condition and determines the urgency of her complaint. After some time in the waiting room, a certified nursing assistant escorts Sarah to a room and takes her vital signs. A physician assistant, or nurse practitioner, or emergency physician then arrives, takes a medical history, and performs a physical exam. A medical scribe may help document information in the patient's chart. Sarah will need to get blood work drawn, so a registered nurse or a phlebotomist can draw her blood for testing. Her blood work is sent to the lab where it's processed by a medical laboratory technologist. Once the results come back, the physician assistant or nurse practitioner discusses the findings with the emergency physician, who suspects appendicitis. So they order a CT scan for further investigation. The CT technologist performs the scan, and the images are reviewed by a radiologist. After consulting with the emergency physician, the team decides that Sarah needs her appendix removed. Let's say a different result was found on the CT. The emergency physician may need to reach out to specialists, including a gastroenterologist, a urologist, an OBGYN since she is female, and maybe a psychiatrist. It all depends on those findings. So since our Sarah is going to be sent to surgery, the unit secretary pages the surgeon. And he speaks to the emergency physician and agrees to proceed with the surgery. A patient transporter takes Sarah to the preoperative holding area. Meanwhile, a surgical technologist prepares the operating room with sterile instruments. And those instruments are cleaned and decontaminated by the sterile processing technician. An anesthesiologist, maybe along with a nurse anesthesiast, starts the countdown to put Sarah under. By the time they reach 3, Sarah is asleep. After Sarah's appendix is removed, patient care assistants transfer Sarah to the recovery room. While Sarah rests, a medical transcriptionist records the details of the surgery for her medical record. Medical coders will later submit these details to Sarah's insurance company for billing. So all this information is stored in the hospital's electronic medical records that's maintained by health informatic professionals and supported by health administrators. From the nurse coordinator to the chief medical officer, everyone works to ensure things go smoothly. And unbeknownst to Sarah, the admission coordinator is already preparing her insurance information for billing, and the discharge planner is coordinating her post-surgery care at home. Let's say Sarah's stay in the hospital led to complications like muscle weakness or mobility issues. She may need to work with a physical therapist to regain her strength and function. If Sarah requires help with everyday activities like bathing or dressing due to that weakness, occupational therapists may be consulted to provide adaptive tools and exercises to help her regain that independence. While she's in the hospital, a pharmacist might review and adjust Sarah's medication based on her admission hospital orders. Dietitians are often involved in patient care, especially if Sarah's condition requires specific dietary adjustments. So Sarah's journey in the hospital involved a mass team of healthcare providers working together to ensure her recovery. The multidisciplinary approach, which includes collaboration between doctors and nurses and technicians and support staff, helps create a comprehensive treatment plan and provide Sarah with the best possible outcome. Even after her discharge, she may continue to be supported by her primary care provider, therapists, and home care teams, ensuring that she's on the path to full recovery.